I'm just asking, what's the difference between a permanent stent and a temporary stent?
Okay, first of all, the permanent stent is basically a stent that its material is not like the regular stent that we usually use. The regular stent is made of something like plastic. It's actually polyethylene, but to make it simple, it's something flexible like elastic. But the permanent stent is made of something like metal. We use it in cases where we don't expect the condition to improve or the vessel to widen on its own. There's difference between the narrow stent and the regular stent.
Is it possible for the body to reject the stent
No, it's not really rejection. It's more about how the body interacts with it.
between it?
Right, exactly. But it's not in the blood. When a foreign object enters the bloodstream, a reaction happens. But this isn't in the blood, it's inside the ureter. The ureter is lined with mucosa, like the mucous membrane that lines the inside of the mouth.
That's it indeed.
But the point is, not everyone's body accepts the stent in the same way. Why is that? First, a patient's acceptance of the stent depends on several factors. First, the material of the stent, the type of stent, because there are different grades.
There are levels, yes.
Of course, absolutely. There are more expensive types and there are cheaper types, and every company tries to develop its materials to reduce the symptoms that come with it. The second thing is the size. The bigger, thicker, and longer the stent, the more symptoms it causes.
So, on what basis do they determine the size? How do they know which size to use?
There isn't just one standard size. For example, if someone is tall, say 180 centimeters, I can't put in a stent that's size 26 or a small one like 20. That would be too short. I have to use a size 28. But if I put a size 28 stent in a patient who is 150 centimeters tall, half of the stent will end up coiled inside the bladder, obviously, and that will cause a lot of irritation.
It's not the doctor who writes the prescription who decides. It's determined based on the patient's body structure. This is one of the types of considerations.
Exactly. These are all considerations. These are all factors we focus on. We focus on the material, we focus on the quality of the material being used, and we focus on its overall length and its diameter. The thinner it is, the fewer the symptoms experienced. We intentionally use a larger, more substantial stent in terms of French size when I clearly see that the clinical situation is quite tight and I genuinely want to effectively widen it, so I carefully put in a bigger, thicker, and more robust stent. However, when it's a more routine and straightforward case, I typically use a thinner, more flexible stent. Personally, I truly prefer the thin stent, and the patients definitely feel something significant. Okay, I'll talk about the side effects. I'll tell you about the side effects that can happen from the stent. As we mentioned, it varies from person to person. Some people might not feel it at all. Like some people might forget about it to the point that they come to me after 2 years having completely forgotten they even have a stent in the first place. And there are others who, from the very next day, come to me saying, "Help me, I'm suffering because of this stent." Especially with the Phoenix stent, men complain more about it. I remember one woman who, after just 2 days, complained about it, but usually that's it. The issue is resolved or the case is over.
Now, let's take a moment to consider the next important point in our discussion. This is temporary, it has a purpose, meaning you put it in for a reason, so once you remove it, that's it.
If you remove it early from the case, what happens? You'll have to take on some risks. The risk of pain, the risk that she might get some cramps or that she might have some discomfort. After all, we've broken up stones above, so something could come down and block things. Sometimes everything goes smoothly, but she might still get some cramps. By the way, there are other indications for placing a stent. Sometimes we even do a scope just to widen things for the patient. Sometimes the ureter is just not compliant, meaning it doesn't want to expand. You try to dilate it, but it simply refuses to open up. The ureter, yeah, there's nothing in it that would make it expand. So in that case, we can't force it to expand, because if we force it, we might tear the ureter. So what we do is place a stent and leave it for 2 weeks. And this stent will expand the ureter on its own. After 2 weeks, we go back in, remove the stent, and find the ureter wide and perfect. Then we go in, break up the stone, remove it, and that's it. So this is an important technique, and we use it a lot. The stent helps with dilation. That's its main purpose.
You can even do this important step, if you wish, well before the main medical procedure actually begins.
I'll tell you that some doctors do this as a routine, especially for flexible ureteroscopy for the kidney. They tell me I have to insert the stent and dilate it. No. I see that you want the stent, and then the patient comes back after 2 weeks, and the stent is used. There are people who routinely do this as 2 separate procedures. Personally, I insert a wide stent, and if it works well, that's great. If not, then fine, we put in the stent, and that's it. Of course, there are other considerations, like if the patient will need to undergo surgery more than twice, or if it's in the private sector and they'll have to pay more than once, there are many other factors. That's why I prefer to do everything in one go. I don't put in a stent unless I really have to.
Are there specific situations where you absolutely can't put in a medical stent device?
No, there aren't any cases where you can't. If it seems impossible, you have to find a way to make it possible.
So it's more of a technical issue, not a matter of.
I object because sometimes the solution to the problem you're facing is to put in a stent. For example, if the ureter is blocked, you put in a stent and the patient gets better, even if nothing else works. You have to put in a stent to drain the ureter if urine isn't passing through. Its appearance is something you have to accept. You have to put it in when necessary. Placing the stent resolves the issue. What does that mean? It means, for example, I have a stone in the ureter and there's a blockage, and I can't reach it because the ureter is too narrow. So what should I do? I have to put in a stent. Yes, I have to put in a stent. The second solution, if I can't or fail to insert a stent, is to insert a tube into the kidney itself to drain it directly from the kidney, and it stays there.
And what if the situation gets worse?
And the blockage remains until there are other solutions, like trying to insert the stent from above, from the kidney, or trying to break up the stone with shock waves and then attempt to insert a stent. So there are many options, but the important thing is to keep dealing with the situation. What does that mean? It means that if there's a stone causing this condition, this part is crucial. What is it exactly? It has to be resolved. Yes, of course. So what do I do? So this is the first critical period. How is the stent, Saad? I'm coming in just to check the stent, but actually I'm here to insert a stent. And for the patient, inserting a stent can be a lifesaver. For example, if someone has a stone blocking the ureter and severe inflammation in the kidney, that means the urine above the stone, which is blocked inside the kidney, has started to get infected and become pus-filled.
Of course.
This could potentially lead to a severe condition like sepsis, so I absolutely have to insert a medical stent. Yes, the stent is exactly like when someone has an abscess, and I make a careful incision to drain it. It's essentially a drainage device, basically. If I can't do that, then the other solution is to insert a full tube right away, a complete tube, to drain all the urine from inside completely.
This is something that needs to be done quickly because the urine also contains a higher concentration of toxins, so the matter requires urgency. All right, speaking of inserting the stent, does it require general anesthesia or not?
Local anesthesia. For females, although honestly, I personally don't really like it very much either, It can be done with local anesthesia because the female urethra is about 4 centimeters long. I've tried it. We insert the scope and can see the opening, so it's a quick procedure. But for males, the procedure is a bit more difficult. And now there are flexible cystoscopes for the bladder that are very thin, so we can insert them with local anesthesia through the urethra. We advance the scope all the way to the bladder and observe the condition. Then we insert the guide wire and place the stent over it. But it's preferable for the patient to be asleep because with local anesthesia, they might still feel something, of course.